Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to Wellness Evolution, a podcast with inspiring and thoughtful conversations highlighting the connection between health and wellness. Whether it's through finding the right treatment or making lifestyle changes, we hope these stories provide relatable topics and perhaps personal inspiration. So join me in exploring the many paths to wellness through the lens of a diverse group of people as we cover topics such as chronic illness, mental health, spirituality, and everything in between. We'll start today's episode with a mantra. I am relaxing into the unknown, and I am trusting that my mind and body will do its best to heal and comfort me through any challenges that arise today. My guest today is Dr. Matthew Stanford, and we'll be speaking of mental health diagnoses and how it can affect us and our loved ones in life situations. He is the CEO of Hope and Healing Center and Institute in Houston, Texas, and an adjunct professor of psychiatry at Baylor College of Medicine and the Houston Methodist Hospital Institute for Academic Medicine. His research on the role of faith communities and mental health has been featured in such national publications as the New York Times, USA Today, and Christianity Today. A fellow of the Association for Psychological Science, he is the author of numerous research articles in psychology, psychiatry, and neuroscience, as well as several books, including his most recent, Madness and Grace, a practical guide for pastoral care in serious mental illness. Thank you so much, Dr. Stanford, for joining me today. It's a pleasure to connect with you.
Thanks for having me.
So one of the things that I find very interesting is that when we talk about the challenges within the mental health community, there's the stigma and a challenge sometimes to speak up about the difficulties that an individual might be having. So for example, within our chronic illness community, we find that there is that vulnerability that you have to have of openness. So what have you seen as the crux of when someone finds themselves in a place where they need to reach out and get support or help for what they're experiencing?
Yeah, there's quite a bit of stigma in the general population. In fact, stigma is one of the primary reasons that individuals don't actually get care. A majority of people with mental health problems never receive any treatment in the United States. And like I said, stigma is one of the primary reasons. So you have kind of a stigma where people think of individuals with mental health problems as violent or demon possessed or just bad people in general, and they're to be feared. So they kind of avoid them. There's also a lot of cultural beliefs and also just a lack of education and knowledge of kind of how the brain works and about psychology and neuroscience, where people just kind of think these are not very serious problems or something you can just think your way out of. And then from a cultural perspective, there's a lot of distrust of the medical establishment in general because of past wrongs that have been done. But also there's a sense of not wanting to shame the family a lot of times, where if we have someone who has a mental health problem and that's known by people outside of the family, then that'll bring shame on our family. So there are times where we engage different cultures where the family is actually trying to keep the individual from getting care so that others don't find out.
And when you bring up families, it is something that I think is, sometimes common, that fear of us. What will they think? How does that affect the way that they're seen within their, community and friends? And we worry more about the other person than the challenges that we, may be going through. Do you have suggestions of maybe the best approach when you're having this difficulty of how to bring that conversation to your loved ones?
Yeah, I think that, education is key. So I think if you can help your loved ones become more educated about, what it is that you're struggling with. Although, one of the problems in relationship to mental health stigma and shame and these problems we're talking about is that we often put the impetus for education and going beyond the stigma on the person that has the problem, the actual stigmatized individual. So, for instance, we had a national campaign that said, it's okay to say, that was the campaign. It's okay to say you have a mental health problem. Well, who decided it was okay to say? I'm not sure someone decided that. It's not okay to say. My clients, some of them, they were to tell their bosses that they had certain mental illnesses, they might be fired. So we really need to educate. So, what I would say, is if you're a family member, and you have a loved one who has said that they're struggling with a mental health problem, before you try to make a decision on what your view of that is or how you should react, educate yourself as much as you possibly can about that illness that they say that they have been diagnosed with or that you think they may be diagnosed with. Because I think if you begin to look at it from that perspective, you'll realize there's much you don't know, and this individual is going through great suffering. This isn't an issue where someone says, I have a mental health problem, and somehow that's a good thing for them. I mean, they're going through a lot of suffering. Whether you agree with the problem or not, where you stigmatize the problem or not, you certainly want your loved one to not suffer. And I think most people would want to do what they could to help their loved one not suffer.
And when we talk about mental health and the stigma and the conversation, like you mentioned that campaign, and there's so much more openness, I think to discuss it. And like you said, there are ways for us to really go about it and support someone wherever they are at and where that comfort level is, but that they do feel that openness to share. How have you seen that conversation, maybe change over the years now that, mental health is more of a conversation and we understand that it is, in stages or in different experiences. And it could be something that someone is experiencing in different ways than what we have perceived in the past or, even assume now.
Yeah, and there's definitely been a change. And you even see that generationally if you look at individuals now. I mean, individuals that are more in the elder generation, that are older, they still won't talk about mental health problems. And one of the fastest growing age groups for substance use and suicide are those that are over 65. But those individuals just simply will not talk to a mental health care provider because that was kind of ingrained in them as they grew, that that's what you talked about. Whereas on the other end, you have almost the opposite problem. And that is, we have tried to educate our younger individuals that you need to talk about these problems and that mental health issues are serious issues. And where you almost sometimes see an over-pathologizing of any and every problem. So a person struggles with anything and it's a mental health issue. When in reality, if they had the proper coping skills and resiliency and support, just friends to listen, talk to, things like that, they would be able to move beyond that. But oftentimes they feel like they're not able to do that. And so we have a real range. And I don't think that there's necessarily a negative that we've gotten to a point where it's a little bit more accepted to talk about. I will say this, though, while I certainly would agree with you that it seems to be more accepted to talk about in a general sense, I have not seen much change in the way people respond to somebody who reveals that they have a mental health problem.
And I was going to say, when you mentioned that, I think it is true. We do have, the idea that it is a challenge that someone is going through at that time, which is, when we talk about chronic illness as well, it's something that you are dealing with and it is ongoing and it shows up in different ways and in different ranges. And there isn't a, per se cure. There are things that we can do to help aid. There are things that patients can do to help support what they're going through, resources, having a conversation with family and loved ones, finding support within their community, taking medication, going to counseling. Like there's different ways that it can be addressed, but it is very true that there's still that conversation of the comfort level of someone saying, I have been diagnosed with being bipolar, have been diagnosed with being, schizophrenic, and then how does someone react to that? So there's still ways for us to kind of grow and have that empathy. And as you said, educate ourselves, because there is so much to know and learn, and everyone is so unique and different that we have to be open to that.
And the discussion about mental health is not being driven by mental health organizations or individuals with mental health. It's being driven by the media. It's unfortunate, but we're doing this podcast not too long after the Uvalde shooting. And, we've already heard 100 times that this young man struggled with mental health problems, when I can tell you, having looked into it myself, there's absolutely no history of an individual sitting down, diagnosing this individual, working with him from a mental health perspective. Whether he had a mental health problem or not, I have no idea. And certainly no one in the media has any idea. The majority of people who've ever committed heinous crimes like that certainly don't have mental health problems. People with mental health problems are more likely to be the victims of violence than the perpetrators of violence. That's what research shows us. But that's not the narrative. And so, as we said, there's a lot of discussion around, people who have bipolar and people who have schizophrenia and people have, this or that. But, when it comes down to, I want one of those people sitting next to me somewhere, most people would say, I don't because I'm afraid of them. What are they going to act like? Well, they're going to act a lot like you act. So, I mean, but it's just not a educated conversation. And that's unfortunate. The fact that a majority of them don't receive any care in the United States is not because our treatments don't work. It's because it's a stigmatized condition. I mean, imagine if we were having a conversation right now and I said a majority of people with cancer in the United States don't receive any treatment. I mean, we would be protesting in the streets. But a lot of people are afraid of individuals with mental health problems.
And when you talk about, just the difference in that access to care, what are some of the barriers that, you have seen just throughout your career? Are some of those things that maybe we do, see and can easily point out? And then what are some of those other barriers? I know we talked about stigma being one of them, and people, feeling like being labeled with a mental health condition is seen a certain way. But if you could share any of those barriers to the access to mental health services, within our society, or maybe just personal within an individual seeking help.
That's another misconception that people have. And I am accepting of mental health problems. A person with mental health problems, they just need to engage the mental health care system and they'll just get treatment and get better. But the reality is, as I said, the majority don't get any care. And I kind of put the barriers to care into what I call the 3 A's: accessibility, affordability, and acceptability. So within accessibility, you have the fact that we have far too few mental health care providers or mental health institutions here in the United States. I mean, I live in Harris County, which is one of the most densely populated counties in the country, 4th largest city in the country, Houston. We have 1 psychiatrist for every 8,500 people in Harris County. So imagine if you move to a more rural community. I mean, 60% of the counties in the United States have no psychiatrist in the county, the entire county. So, there's very few mental health care providers for those going around. And the same thing with mental health beds and facilities. In the United States today, there are less than 100,000 psychiatric beds in the entire country for tens of millions of people that struggle with mental health problems. So accessibility is a real issue. We don't have a real continuum of care. You really have to go right to a high-level provider, and then you're hospitalized. There's not those lower levels of care that we see with more traditional medical problems. And so accessibility is a real issue. Affordability, the reimbursements for mental health care from insurance are so low that the move in mental health care for providers is away from insurance, from even accepting insurance, and going to direct pay from their clients. And so less than 50% of psychiatrists in the United States still take insurance. You have to pay directly, and it's expensive. And the move is the same in therapists. Many insurances don't even cover mental health care, and people, they don't find that out until they may have really good insurance for physical health problems, but when they try to access it for mental health care, they find out it doesn't even cover psychiatry. And that's actually quite common. So, just this idea of paying for mental health care, and that's probably the primary reason that people don't receive care, is the finances. And then finally, like I said, acceptability, just this general sense that it's not okay to talk about these problems, and that somehow these people are bad or different. And, we don't think about people with cancer that way, but your brain cannot work right. And that's going to cause you to think differently and act differently and feel differently. And again, that's no different than any other organ in your body. So those are kind of the ways that we think about it. But even something as simple, just to give you a real simple example, even something as simple as transportation, because there are a limited number of providers and they are spread out, research shows that people with mental health problems report on average that they have to travel usually at least an hour to and from their provider to get care. So, an individual who doesn't have easy access to transportation has already been kind of taken out of the equation. They're simply not going to be able to get to care. And that's actually one of the very few good things that has come out of the pandemic, is that more mental health care providers, more providers in general, but mental health care providers also, are now offering virtual visits. And so if you're in whatever county, as long as the provider is in your state, they can be anywhere in your state and provide you with care. So I am optimistic that may make access a little bit easier for those who, again, have the availability of computers and things like that to be able to access them.
And I think it is something that has come out of the COVID pandemic, for all the hardships that we have all experienced just, as humans, having the opportunity for telehealth to be something that insurance is covering and that healthcare providers, are able to make the time as well within their schedule to have these appointments, I think has just created a healthier ecosystem for people who have the ability to, at least through technology, get those services. It definitely does not solve all of the other disparity issues and barriers, but it is a positive to know that is an additional way that we can connect patients with healthcare. So I agree with you that we have to stay optimistic that this is, this door continues to open and widen and that we're able to have more people access it. As we're talking about the journey that someone has with a mental health illness or chronic illness, I know that, faith is something that's very important to us as individuals and in many different ways. I always say, if you come to my home, you will find every symbol of faith that you can imagine, from photos to statues to paintings, gifts that I've been given. And really, for me, it's just that openness of spirituality. And I know that everyone has a different relationship with that. You have a rich education and background in faith and dealing with mental illness. What do you feel that connection is or that learning piece is for someone that's struggling with, maybe accepting a diagnosis or care or services or feeling that their faith and, a mental illness challenge where they maybe don't know how to get that support or how to speak to someone?
Yeah, faith is very common in the mental health space, and even for therapists or psychiatrists who don't present themselves as having a practice that engages or incorporates faith, it's very common for clients to bring up their faith or their spirituality in that environment. Because I think, mental health, as most serious medical conditions do, it causes you to ask very significant questions about your mortality, about your existence, about the whys. And then with mental health, depending on the mental health issue you're struggling with, you may hear voices, you may see things, you may have different perspectives on things than other people are having as a result of your mental health problem. And those things can be very spiritual, both in a very positive way or in a very negative way. So, people will tend, particularly people of faith or people that are spiritual will tend to adopt kind of one of two approaches to dealing with that in the context of their mental health problem. They'll adopt what's referred to as a more positive religious coping strategy where they see God involved in a positive way in this, that he's going to empower them in their recovery. He's present with them. He's helping them through this. So there's something bigger than themselves that they can connect with that will strengthen them and help them move forward. Or a negative religious coping strategy where it's like, God is punishing me, that type of thing. This depression is because I did something wrong. If I could just figure out what it was I did wrong, those type of, this is a demon, it's all a negative, it's kind of an attack on me type of thing. And what the research shows is that individuals who adopt a negative religious coping strategies have very negative mental health outcomes. It's much more difficult to move them forward and help them progress. Whereas those who adopt a positive strategy, it's just the opposite. It's very hopeful, helps them build hope. And I think from a religion and spirituality perspective, I think number one, hope building is the greatest benefit there. And that you are able to connect with something larger than yourself. And if you believe that there is a good God outside of you that is in control of things and has your best intentions, his intentions are good towards you, well, then that's a very much a stress reducer, and you're able to use that in a positive way. And so hope building is much easier when you're dealing with it within the context of faith and spirituality, because really the hope for the client who isn't connected to something larger than themselves is that you as the mental health care provider will be able to help reduce their symptoms. And that doesn't always happen. You certainly can improve their quality of life, but they still may struggle quite a bit. And so if their hope is in you to kind of move them forward, that can be very frustrating and lead to a lot of kind of frustrated failure type of thing. So I think it's a tremendously important part. I think one of the problems, though, is there isn't a nice kind of connection between the faith community and the mental health community. And in some places, they actually are very kind of fighting one another almost. But in the United States today, people with mental health problems are more likely to engage a clergy before they engage a mental health care provider or a physician. And while 90% of clergy report that they do some kind of spiritual counseling, less than 10% ever make a referral to a mental health care provider. And then even beyond that, a really nice study was able to demonstrate that the level of pathology, the level of severity of illness of people approaching clergy is the same as people that approach psychiatrists. So you're not talking about minor issues here. We're talking about pretty significant mental health problems. Yet clergy, I think most of the time they're just unaware, because people don't walk in and say, "Oh, I have bipolar. I woke up this morning, I have bipolar disorder." They walk in and they say, my wife left me. I lost another job. I'm spending too much money. I'm using substances, whatever it may be. Even if they say I'm having a spiritual issue, all of those could be the kind of the symptom of a mental health problem in the background. So, what we've tried to do at the Hope and Healing Center is to try to develop training approaches to where we can kind of bring the mental health and the faith communities together so that the faith community really does serve as a real front door to the mental health care system, but also as a healing community to offer that ongoing support that people need as they are recovering.
And when I think about that connection between our patient community and, the physical and that mental connection, I think that, it's an undeniable thing in so many ways that, having a chronic illness, having a physical disease can also create, challenges that affect us mentally. So how do you see that connection between the physical and the mental wellness?
Yeah, I actually had a very interesting kind of personal experience with that. My father, who passed away in 2014, had struggled for a long time with pretty significant cardiac problems. And so at the end of his life, in the last few years, he had to have a LVAD implanted, which was basically an artificial heart. It runs for your heart. And so, as I'm sitting there with him in the hospital before he's going to go to surgery, a woman from the company that makes this artificial heart comes into the room and she said, "Mr. Stanford, I'm so-and-so from the company, and I need to do your spiritual assessment before you go off to surgery." I was fascinated, so I pulled a chair right up next to her. I wanted to hear that. And so she asked him about 10 questions, and they were pretty general. They were kind of like, do you believe in a higher power? Where do you believe healing comes from? Do you believe that this higher power is involved in that? And just a few questions, not dissimilar to what I just talked about a minute ago, about connecting with something larger than yourself in the context of your illness or your problem. And so, she finished and they were going to take my dad off. And so I asked her, I'm like, well, tell me about this, because obviously this company is not, some spiritual company. They're looking to make money, So she said, well, what our research shows us is that individuals who have an active spiritual life and are connected to something larger than themselves do better with our device than those who aren't. And so they have some recommendations for the doctors if the person isn't connected or if they are connected. And I mean, this wasn't a church or a synagogue doing this. This was a company that likes their equipment to work so they can make more money. So they knew that indeed it was, and that's indeed what we find, what you just said a moment ago. I mean, when people who have, even chronic physical health problems or chronic pain or things like that, they often adopt religion and spirituality as a way to deal with that. And those who do, those who adopt that and see that as an important and beneficial part of their life, they have better outcomes and they are healthier. And so, again, depending on your listener, people may go, well, I don't believe that. It's not an issue whether you believe it or not. That's just a fact. I mean, that's what the research shows. Now, we're not picking one faith tradition over another. People who see their faith tradition as important, people who are actively involved in their faith tradition and see this as a positive part of their life, those individuals report better health. That's just a fact. It's been demonstrated physically. They report better health outcomes. That's just a fact. And even more recently, there's been research on what Andy Newberg at Duke calls spiritual atheists. And it's people who identify themselves as atheists, but they connect to something bigger than themselves. So maybe they are very involved in environmental activism, or they're very involved in, trying to get food to people who don't have food, but something larger than themselves. They seem to show health benefits, much like people that are connected to spirituality and religion, whereas atheists who are not do not show those benefits. So it's kind of interesting, this idea of being connected to something larger than yourself.
And I was thinking about the conditioning that sometimes people have, which causes the reaction of, back to that stigma of, what I don't know, I don't understand, I fear. But I love that you said that through the spiritual tradition, because sometimes it is a tradition and it is something that we carry with us based on, the way that we were raised or choices that we made about our spirituality as we got older. Those are things that, we have to respect that there are cultural, spiritual traditions, but we also have to have that openness to understand that if it's something that is, separating us from a person who needs help or who is going through a challenge, that we have to have that empathy to look through that lens and be a support system and be part of their community of help, even if it is something that, we don't fully understand or that we might fear. In my family, we do have a few family members that are bipolar, and it was a learning curve to know how to be supportive and how to give enough support without being overbearing, and also, to teach my parents what this looks like, and based on their cultural upbringing and their, religious beliefs, there were some barriers there that we had to work through with them, to have them look at this as a health challenge. The fact that it's mental doesn't mean that, it doesn't require the same care as if it's physical. And like you said, the casserole, the phone calls, the hugs, the support, the listening, we still need to make sure we provide all of that for this community as well.
I often just say, just do the same thing for them that you would do for someone with cancer. You don't have to know anything about cancer to be supportive. I think that, one of the mistakes that families make a lot of times, and I even see it in the mental health care system, is when people have serious mental illness, they're often just kind of thought, well, that's it. They're done. There's not really anything. They'll never accomplish anything. They'll never be able to do anything. And they're just kind of sold short, and, we'll just dope them up with some meds and kind of put them over here. And I find that really disturbing because, that's a person and they have intrinsic value. And let's see how well we can manage their illness so that we can help them move their quality of life to where they want it to be, or get at least as close as we possibly can. And then I think families should never listen to a mental health care provider that says, oh, well, your adult child is done. That's it. They're never. And then, I think secondly, families a lot of times will begin to pathologize every negative thing that ever happens in this person's life. So, a guy has bipolar and he loses a job. Oh, well, there you go. He lost another job because of bipolar. Well, you don't, a guy has diabetes. You don't go, I lost another job because of diabetes. It's possible they could have lost a job because they acted out, but it's also possible they could have lost a job because they did something stupid that anybody would have done. Everything is pathologized. Anytime they get angry, anytime they're sad, anytime anything happens, they're kind of held to a different standard. And that standard is, well, you just mess up all the time because of your illness. And they really become little more than an illness. They're not even a person anymore. And I think we have to be very careful about that. That's not providing support for a person. Support is having a best hope and goals for a person and doing whatever you need to do to kind of help them move towards that. And they're their goals, not your goals. Whatever your expectation is for them, that doesn't really matter. What's their expectation?
And when we talk about the patient's, kind of journey, and I go back to the things that hold us back from saying, I'm feeling anxiety, I'm feeling depression. What would you say are some of the things to kind of look out for or make sure that we, do share when we're experiencing it? Because I think nowadays there, just with the isolation that we went through with COVID, everything that's happening at, in our schools, so many things that can cause anxiety and fear and things that, are categorized under, having a mental health, crisis. What are things that we should really look at so that we know if these are normal stressors that can cause some issues? And then these are things that you really, whether it's a friend letting you know or thoughts that you're having yourself, things that you really want to seek immediate immediate help for?
Well, there's a real common question people ask is like, when should I go to a mental health care provider? When do I even know? And I think you have to realize that there are subclinical aspects of, like, obviously we all know what it is to be sad. We all know what it is to be anxious, but those aren't disorders. There's a real difference between sadness and depression. So to cross the line of disorder, really what you're saying is that you have become not fully functional in some sphere of your life. So we usually talk about work, school, and relationships. So if what you're struggling with, let's say that it's anxiety, is causing you to, say, blow up at your family members, or you're not able to go to work, well, you've actually crossed over a line where you need to see a mental health care provider. Okay. So that's kind of the line that we as individuals should look at personally, but also for our family members. If we see, somebody that's struggling to get out of bed and even get to a doctor because their mood is so down, or even get to work, well, that's a problem. I think for us individually, on a lower level, if we have family and friends that we can just talk to about how we feel, we are so isolated as a society, and social media has only made that worse. And we've convinced ourselves that we're actually more connected, but in reality, we are more isolated. Texting people removes all opportunity for you to engage them at a nonverbal level. You don't see their facial expressions. They could just flat out tell you, I'm having the best day of my life, while they're laying in bed crying. There's not an intimacy in that connection. So having someone that and regularly sitting down with someone and just talking about how you feel about things, not about how your job is or what your job is or the baseball game, but how you feel about things. And I also think just taking a personal inventory of where, asking yourself, back to those 4 things that I mentioned of kind of how I look at people. How am I doing mentally? Am I having negative thinking? Am I stressed out? Am I anxious? How am I doing physically? How am I doing spiritually? How am I doing relationally? And then maybe ask your friend that. Maybe that's just a way you engage. But, that kind of having somebody that you can share with how you're feeling goes a long, long way. But I think, unfortunately, we just don't do that. And those doing that, talking about this when it's just kind of minor issues where you're struggling with something stressful at work or whatever, really is very preventative. So these things don't build up and move you over that line. You would much rather be talking to somebody and getting some assistance before you cross over the line into disorder. But once you do, you need to get some help. After you've crossed over the line of disorder, just sitting down with your friend and trying to talk about it is probably not going to be enough.
And I will say one of the things that I've seen just within our patient group is a lot of stories that are about people having stressful situations that have caused, a flare or really exacerbated their symptoms, or, that's when they had the onset of challenges within their condition and, went to seek treatment and diagnosis.
So, one of the things that we do with our clients is we help them identify their triggers and their cycles. And so, do you normally get more depressed or anxious around the holidays? Okay, well, if you know that ahead of time, then you can seek out additional support as the holidays are coming. And so, there really is a sense of knowing yourself. You kind of self-examine, but also doing that with another person where they're examining themselves and you're talking to one another and you're helping one another. So let's say you're a married couple and you know that every time a holiday comes along that your husband gets particularly stressed out and anxious. Well, that's something you should talk about. Not just talk about, well, you get anxious, but what can we do to help you not get as anxious this holiday season? What are some positive things that we can put into place? And then understanding what it is that, maybe it's a particular relative that triggers it, or a particular historical memory that's brought back because of, some trauma that you had or something. So, figuring that out can make a huge difference, an absolutely huge difference. So that's a good point that you bring up. Understanding yourself and that this is a chronic condition and it has ebbs and flows. People with mental health problems have good days and bad days, just like people without mental health problems. It's just that I often think of mental health as kind of a magnifying glass. It makes the bad problems that much worse. And so the good days maybe don't seem to counter it enough.
And I think it makes me think of the importance of compassion, because although we're talking about, labels of diagnosis and labels of illnesses, the reality is at the core of it is somebody that has a challenge and needs support.
That's the end of it. That person is in distress. We use the term distress all the time. We don't try to stay away from the mental diagnosis. I mean, that's just for us. But distress, that person's in distress. I care about them and I don't want them to be in distress. How can I help them not be in distress? Absolutely.
Well, I am just very thankful just for this conversation. I think there's so much that you've shared that, there's pieces of things that we assume, there's pieces of things that we know, and then there's so much that we learn, about this topic. And as you said, it's something that is changing. There is more conversation around it, but we still have to be very intentional and purposeful of what are we trying to learn. And it is, how do we provide support and how do we have that empathy? And, I feel that with your shares, it's really opened up the conversation that stigma is such a barrier for us to really come together as a community. And I think breaking through that is going to take vulnerability, is going to take conversations like this, and really to look at ourselves and see what our challenges are, and then think of what someone else might be going through. So I'm just very thankful to you, Dr. Stanford, for taking time to do this recording with me. I appreciate your learnings, and I know it will be very helpful for our listeners and open more conversation. Thank you for listening to this episode of the Wellness Evolution Speaker Series, a podcast inspiring new conversations about the relationship between health and wellness. I'm your host, Angel, and I appreciate you joining us on this journey. Remember to subscribe to our podcast so you never miss an episode, and help spread the word by rating our podcast, writing a review, and sharing us with your friends and family.
If you or a loved one are experiencing mental health-related distress, particularly if the thought or feeling is new or has increased recently, you can call or text the National Suicide Prevention Lifeline at 988 for help at any time. The Lifeline provides free and confidential support for people in distress, prevention, and crisis resources.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.